Hi everyone, Nicole Lang, acupuncturist and creator of The Baby You Want here, and I think I've got a pretty hopeful and exciting topic to tackle today, especially if you're dealing with either unexplained infertility or you have a fertility issue that mainstream medicine doesn't have a lot to offer besides do this general fertility treatment and hope it works. Let's talk about why there is always room for improvement if you know your Chinese medicine differential diagnosis. Now, before I start, please subscribe, or better yet, subscribe and hit the bell so you get notified when I add new videos to my channel. I am so grateful for your support and glad to be on your virtual fertility team. Now, onwards. Here's what you're about to learn. A tale of two fertility approaches. Here we'll break down two different but often very complementary systems of medicine, mainstream Western and traditional Eastern. Differential diagnosis, awesome sauce. In this section, I'll explain why there is no such thing as unexplained or nothing we can do in fertility cases in traditional Chinese medicine. And last but not least, holistic takeaways. Here you'll see how to take what you've learned in this video to the next level and find your own TCM differential diagnosis so you can move towards your goal of parenthood. I like to use a simple analogy to compare Western fertility care, aka mainstream fertility medicine, and holistic fertility care, aka traditional Chinese medicine, which is what I have a master's degree in and practice. And the analogy goes like this. I want you to picture yourself walking into your RE or OBGYN or even a general doctor's office and handing them your main concern. I want to have a baby, but it hasn't happened. Your main concern here is like a microscope slide to their way of thinking. Now, through the very act of you just walking into their specialized office and telling them your specific concern, you've already limited the part of your body that they're going to look at and work on. Here, it's just going to be your reproductive bits and pieces. And now it's your doctor's job to put that little microscope slide, your main concern, onto their fabulous microscope. That's their training, experience, and expertise, which is awesome, and examine the smaller details within your slide. Now, I call these details your reductionistic reproductive factors, and you should try to say that 3 times fast. Reductionistic reproductive factors, reductionistic reproductive factors, reductionistic reproductive factors. Easy action. Your reductionistic reproductive factors include specific hormone levels and ultrasound findings and pelvic blood flow levels, sperm samples, egg factors like age and quantity, anatomy, and more. And it is absolutely amazing that doctors can look at all this stuff because reductionistic analysis of your bits and pieces can sometimes tell really important stuff. But sometimes it can't. Or sometimes there's an issue with one of your specific factors, but there's not much your doctor can do about it because they don't have a super great pill or procedure or reliable way to address that specific thing yet. Things like reoccurring pregnancy loss or age-related egg issues, for example. Now, when you see an Eastern medicine fertility practitioner like me, your main concern still sounds exactly the same. Hey, Nicole, please help me get and stay pregnant. But to someone like me, your main concern is more like a single piece of a much bigger puzzle and less like a microscope slide. For me to do my job, I need to get bigger. So I use my holistic Eastern medical training and experience and expertise to add up lots and lots of different pieces. Your sleep, stress levels, career, support network, digestion, relationships, budget, energy level, allergies, PMS signs, period signs, pain, and so much more are all relevant to me. I'm going to add them all up because the more puzzle pieces I add together, the clearer I can see your big picture, and that big picture will show your whole person patterns of imbalance, otherwise known as your TCM differential diagnosis. Okay, so no matter what your microscope slide, aka your specific reductionistic reproductive factors say, even when they say nothing or there's no good way to fix the things that are happening there, when we look at a person's big picture, we can always find things to work on, and we do this by working on improving the big picture using that unique differential diagnosis. And differential diagnoses are super cool. Let's say we have two people with unexplained infertility. Maybe their Western doctors would tell them to do the exact same thing. Maybe something like, you should start by trying Clomid and IUI, that's intrauterine insemination. But when we look at their puzzle pieces holistically, we'll see they're very, very different, like this. Person number one is tired and cold a lot of the time. She drinks coffee to keep her energy up. She tends to be a pretty anxious person and has a hard time turning her brain off. She's often bloated and tends to get looser stools, especially at the start of her period. She has a differential diagnosis called Qi deficiency. Person number two is hot more of the time and sweats kind of stinky yellow staining sweat. She tends to be impatient and irritable. She's more prone to being constipated or having heartburn than anything else, and she's prone to some pretty intense vivid dreams and even nightmares sometimes. This person has a differential diagnosis called excess heat. Now, even though these two people's microscope slides are the same, unexplained infertility, these two people have super different, pretty much opposite differential diagnoses. So they would benefit from super customized lifestyle tweaks and Eastern fertility treatment options that are very different and customized to each of them. And these are just two differential diagnoses. There are loads of others. Qi stagnation, yin deficiency, yang deficiency, blood stasis, dampness, blood deficiency. These are some of the most common patterns of imbalance that I see, and people often will have a mix of more than one mixed together. We can get really, really nuanced and really, really customized and make everything feel better, which is great, especially when Western medicine doesn't have much to hone in on. So working on your whole body and your mind and your life all together is always a really lovely thing, but especially awesome if you've got unexplained infertility or anything else where your mainstream medical doctor says they're pretty limited in what they can offer. Your differential diagnosis will help you get super nuanced and feel way more empowered because you're gonna have things to work on that feel doable. And when your entire body and mind and life start feeling and moving towards a more healthy and balanced place, it's gonna make you feel better and improve your fertility outcomes and set you up for better chances of pregnancy success and parenting beyond all this. I've seen so many people strike out with Western options and then take a step back, decide to work on their whole big picture, and then either get pregnant without fertility treatments at all or revisit treatments again and have way better outcomes. One person who recently graduated from my 90-day online program told me that she had an absolutely horrible and traumatic first IVF experience that left her feeling like she would never do it again. She signed up for my program and then sat on her patio with a cup of tea and watched a few lessons every week. And by the time she finished a few months later, she felt way more informed about IVF and holistically healthy enough to try IVF one more time. Not only was her IVF a success, she felt empowered and healthy going through it and took back some of her power. Now, it's worth saying, even if you have a very cut and dry, obvious Western diagnosis and there are things that your doctor can do about it, say you have PCOS or endometriosis, every single person can still benefit from looking at their whole body, mind, and life and working on feeling more balanced. I personally have both PCOS and endometriosis, and I didn't have a period for 2 years in my mid-20s after coming off birth control pills. I got my cycle regulated and got pregnant naturally twice while working on my differential diagnosis. Plus, it made my anxiety and my sleep better, helped my gut out, and benefited me in so many other great ways altogether. I've got a fantastic differential diagnosis self-led questionnaire that's built into my 90-day fertility program. It'll allow you to make your very own personal differential diagnosis by answering simple questions all about different parts of your body and mind and life. Once you know that diagnosis, I've got specific video lessons to guide you through the very best customized lifestyle and treatment options that are going to give you the most bang for your buck based on your unique patterns. It's all super user-friendly, and isn't the idea that you could start feeling better while trying to have a baby instead of worse by the month a really wonderful thing? It is possible, and I'd love to have you in my program. Right now, you're also going to get 2 30-minute coaching sessions with me so I can help guide you even more and make sure that you're on the right path. A TCM differential diagnosis is a fertility game changer, so get to it. Here's what we just covered. We broke down 2 different approaches to medicine and infertility, microscope slide versus big picture puzzle. They're both really great, but really different. Differential diagnosis, awesome sauce. When we add up individual mind and body puzzle pieces, the patterns that are revealed give you a holistic differential diagnosis and great things to work on. And holistic takeaways. Adding your TCM differential diagnosis is a fabulous way to work on your fertility from another angle and also your quality of life together at the same time. And you can learn how in the Baby You Want program or by seeing an education-focused fertility acupuncturist like me. I know traditional Chinese medicine can feel both super intuitive and a little bit foreign and strange at first. So if you're intrigued, I really hope you'll take the leap and check out my online program. I have designed so much of it to help you get what I do in my private acupuncture practice at the touch of a button. And if you're already working with an acupuncturist, I would love to know. Leave me a comment and tell me, have they explained your differential diagnosis? What do you know about it or not? Many acupuncturists don't take the time to explain this. I think it's super important that they do. Let me know in the comments. As always, thanks for inviting me into your life and for hitting play on this video. I'll see you again soon. Differential diagnosis, awesome sauce. Yeah, cha-cha.